Active medication list. So this is where you're going to want to maintain an up-to-date active medication list. The reason why I said this was you can do this in the system right now. We put in some enhancement for 9.5 so that it'll actually record the dates of when you did the reconciliation. And it will also, you can pull that information in from an electronic source, whether that's CCR or CCD. So that's why I said this was a 9.5 enhancement, even though you can do most of the capabilities now. One of the capabilities that you guys can do right now is where it says on no medications, you can click the on no meds button, and that'll pull in that patient doesn't have any medications in the system. So that's a 9.4 enhancement. So if you guys are on 9.4, you should have that ability to do that. With the active medication list, you're going to want to have more than 80% of all of your patients seen by the provider that have at least one entry or indication that the patient is not currently prescribed any medication, or you want to make sure that the medication they have on there is up to date. And you're going to have that capability by every time they come in, you can check that button that says that we looked at their medications, we asked them the question, and they said everything is good. So here's the denominator. It's the same old stuff, the encounter provider, the encounter type, and then the unique patient count. That's the same stuff as it has been for the last 4 or 5 measures here. The numerator is what we care about right now. The number of patients in the unique patient set where there's at least one medication list, or it says they're on no medication. So that one, pretty self-explanatory, I think. Here's the next one with the med allergy list. So this is just to maintain an up-to-date active medication allergy list. So it's very similar to the last one we just did, except you're looking a little higher on the screen. Not on the current medication list, but on the allergy list. Similar with this one, instead of actually, if the patient doesn't have any allergies, you can put in NKDA or you can put in NKA. It means the same thing in Practice Partner because we've crossed them. So you can put either one of those in there, and that will count as keeping their allergy list up to date if they don't have any allergies. Let me get back to the screenshot. Basically, if you don't have 9.4 or the latest version of the system, you're probably not familiar with the allergies reviewed today and the view deleted buttons, but that's going to give you that date stamp of when that's going to be. The view deleted is going to show any time that you deleted an allergy. So for this patient, they have no known drug allergy. If we put in penicillin on here, it would automatically delete NKDA and would go into the deleted option, and it would show who put that on there and when it happened and all that good stuff. So more than 80% of all the unique patients seen by the eligible provider have at least one entry or indication that the patient has no medication or structured data. The denominator is the same thing that we've been looking at here, so it's the same encounter provider. The type is an office visit and the from to due dates, and then it's the number of patients seen in that patient set. There's at least one item on the medication allergy list, or it says NKDA or NKA. That will suffice for this one.